Hello and welcome to Health Live at Seniors Today. We are, as you those who are watching us live, we are today on April 5th, and April 11th is World Parkinson's Disease Day, and we are on that occasion we are doing the special session on Parkinson's disease, prevention, care, and tips for caregivers. And for this, we've invited a senior neurologist, Dr. Anil Venkitachalam. Dr. Anil Venkitachalam is a consultant neurology at the Apollo Hospitals in Navi Mumbai. He is a highly experienced neurologist with a career spanning over 15 years. He holds an MBBS from the D.Y. Patil College in Mumbai and an MD in general medicine from the Sri Ramachand Medical College in Chennai, and a DM in neurology from the same institution. He further honed his expertise with a Post-Doctoral Fellowship in movement disorders from the University of Alberta in Canada, a recognized center for excellence for Parkinson's disease and movement disorders. He has esteemed positions such as assistant professor and consultant neurologist at the Amrita Institute of Medical Sciences in Kochi, and where he has been managing adult neurology and movement disorders. An active researcher, Dr. Venkitachalam has contributed to several international publications and clinical trials focusing on Parkinson's disease and the like. He's also a passionate educator. As I mentioned, he's been associated with several educational institutions, and he's been mentoring medical students, residents, and fellows in neurology. He has been part of various clinical trials, as I mentioned, and has published over 20 research articles in national and international clinical journals. He's also an active member of the International Parkinson's and Movement Disorders Society and the Movement Disorders Society of India. Welcome to Health Live at Seniors Today, Dr. Anil Venkitachalam. How are you?
Thank you, sir. I'm fine.
The topic today is Parkinson's disease, and you know, as you can see, we have over 125 people who have come in today, who are there live, and more people will join in. There's a great amount of interest which is there for Parkinson's disease. So, without any further ado, I would request you to start your presentation. Those of you who are watching it right now live and who are watching it from YouTube, do note that sessions like these are advisory in nature. In case you have a specific complaint or you want to check about your medicines, etc., always good to go to a doctor, a medical doctor, and consult her or him for advice. Of course, most of our doctors who are there here, they are from recognized, well-networked institutes and centers, so you can always refer to them for a teleconsult. In case you're not in Mumbai or Navi Mumbai, you can always do that. And with that short disclaimer, I would say, I would request Dr. Venkatachalam to start. Do remember that this video is being recorded, and it will be there up on our Seniors Today website on Monday or Tuesday, and we will you can see it over there, so don't worry about not being able to take notes or any recording of the video. It will all be there here. Over to you, doctor.
Hello, everyone. At the outset, I would like to thank you all for giving me an opportunity to speak in front of you all. And the topic I'm going to speak about is Parkinson's disease. So, Parkinson's disease is actually a very common problem, and people often associate it with tremor. When I see it in my practice, a lot of times what happens is, whenever a patient comes to me and I tell them that they have Parkinson's disease, there is a lot of fear, there's a lot of anxiety. And especially senior citizens, when they encounter this problem, they are like, oh my God, it can't happen to me. I'm going to be paralyzed. I'm going to be bedridden. So, what I have done today is slightly different. I've just put headings and I've tried to break down every aspect of Parkinson's disease so that it is as simple as possible for you all to understand in very simple sort of language, so that you don't have any misconceptions regarding the disease. Also, I've tried to simplify it without any medical terminology as easy as possible for you all. And at the end of all this, if there are any questions from the audience, I'll be glad to share it also. So, when you look at it, what is Parkinson's disease? So, Parkinson's disease is a progressive neurodegenerative disorder. That means There is a part of the brain which starts shrinking. There is a part of the brain which undergoes a degeneration. Traditionally, it's called as a disease of the elderly. More than 1% of the population of the world is affected, and the incidence actually increases with age. So as the age increases, over the age of 60, the incidence of Parkinson's disease keeps on increasing. It increases by 1% every year. Over the age of 80, the incidence significantly increases. Again, over the age of 85, the incidence increases significantly. So over the age of 80, there's a 20% chance of people getting Parkinson's disease. Over the age of 85, it's almost around 40%. So as your age increases, the chance of somebody getting Parkinson's disease increases. But we also need to realize that a small subsection of the population, in a small subsection of the population, Parkinson's disease can also present in the younger age group. So younger people are also getting affected. So it's not just a disease of the elderly, it's also a disease of, like young people also. I mean, they are also actually getting this disease. Another thing we need to realize is we always keep speaking about this. India is a young population, India is a young population. And we need to realize this one thing, that this young population is going to get old at some point of time. And as the population ages, there is going to be an increase in the neurodegenerative disorders. And two most common neurodegenerative disorders that are there are like Parkinson's disease, which mainly affects the movement and the motor aspect of the body, and Alzheimer's disease, which is mainly a dementia. So we need to realize this. So, whom does Parkinson's disease affect? So, traditionally, as I said, Parkinson's disease affects people over the age of 60, and the incidence keeps on increasing as the age advances. We also need to realize that males are slightly more affected as compared to women. Again, in around like 10% of the people, it can run in families. So there is a familial incidence, there's a familial sort of a tendency for people to have Parkinson's disease. So it can run in families, it can affect the elderly people. In a small subsection of patients, it can be in the younger population. Also, there seems to be certain groups of people who are at risk, certain communities are at risk, world over there are certain communities at risk. Traditionally, we can see it's very commonly seen in the Caucasian population. Even in India, we don't have a lot of genome wise studies. There's one major study which is available, but still there are pockets and communities where it is very common. So, what exactly happens in Parkinson's disease? So, we need to realize that in the brain, there is a major neurochemical, and this neurochemical is called as like dopamine. So, dopamine is the fuel for the brain. There is a small structure in the brain called as the basal ganglia, and this basal ganglia helps in the movement. So, for example, if I have to walk, the basal ganglia actually gives the command for me to walk. There is also generation of dopamine inside the brain, and this dopamine is the chemical which actually helps in the processes that help in the motor movement. So, we need to realize that we need to have the neurochemical, and this neurochemical is very important. So, in Parkinson's disease, there is degeneration of the basal ganglia, actually the substantia nigra region of the basal ganglia. And because the substantia nigra degenerates, the production of dopamine comes down. And as the levels of dopamine keep coming down, the patient presents with the signs and symptoms of Parkinson's disease. So, when people ask me in common language, it is like the fuel in your car. You know, you may have a big car, but to run your car, you need fuel. If you don't have any fuel, it's not going to run. The same thing for the brain. If there is no dopamine, the brain's not going to work properly. You're not going to have any movement. And that is where, that is where because of the depletion of like dopamine, you have the symptoms and signs of Parkinson's disease. So when we look at the symptoms of Parkinson's disease, we have the motor symptoms of Parkinson's disease, and these actually are tremor, rigidity, akinesia, and loss of postural reflexes, also called as trap symptoms. So the patient may present with some amount of tremor. Traditionally, it's a resting tremor. Patient may have slowness of movement. Patient may have stiffness, reduce in arm swing. Patient may have a loss of voice. Patient may have like mask-like facies. So these are the traditional motor symptoms of Parkinson's disease. So if you want to remember the mnemonic, remember the mnemonic trap. Tremor, rigidity, akinesia or slowness of movement, and P is loss of postural reflexes. So a lot of patients who have Parkinson's disease may present with recurrent falls. So, this may be one of the signs of Parkinson's disease. Apart from this, we also need to realize that patients may also present with the non-motor symptoms of Parkinson's disease. Some patients have constipation, severe constipation. Some patients have bloating sensation in the abdomen. They may have unexplained aches and pains. So they may have shoulder pain, back pain, body pain. Apart from that, patients may present with urinary symptoms. Patients may have nocturia or urinary incontinence. This is one of the symptoms. Some patients may present with neuropsychiatric symptoms like depression. They may have a loss of mood. They may have apathy. All these are the non-motor symptoms of Parkinson's disease. So, as I said, some patients will present with the non-motor symptoms of Parkinson's disease. So, the non-motor symptoms can be neuropsychiatric, where you can have like depression, you can have behavioral problems. Sometimes patients can have cognitive problems like dementia, hallucination, anxiety, etc. Apart from that, some patients present with autonomic problems. They could have problems with respect to their urination, severe constipation. Constipation is one of the premotor symptoms of Parkinson's disease. It predates Parkinson's disease and it can persist throughout the disease for many patients. It's actually a very troublesome symptom. A lot of patients have unexplained aches and pains. They have shoulder pain, they have back pain. So, a lot of times these patients are misdiagnosed. They may go to a urologist, they may go to an orthopedician, they may go to a family physician, but they don't actually come to a neurologist for treatment. In fact, when you ask them, why are you slow? They say, we are slow because of aging. So, we need to understand that Parkinson's is not just tremor. There are other symptoms associated with Parkinson's disease. There are other motor symptoms associated with Parkinson's disease. And there are also non-motor symptoms which are associated with Parkinson's disease, which need to be identified. So, what causes Parkinson's disease? The exact cause of Parkinson's disease is not really identified, but there are, there are certain factors which are postulated to cause Parkinson's disease. First of all, you need to have a genetic predisposition for Parkinson's disease. So, genes do play a role. So, if the genes are loading the gun, lifestyle pulls the trigger. So, there's exposure to environmental agents which can cause Parkinson's disease, exposure to drugs. There are certain drugs like the dopamine blockers. There are certain drugs like levosulpiride, which are used for gastritis. These can all trigger Parkinsonism in patients. Psychiatric medications can sometimes trigger Parkinsonism-like features. So that's another thing. Apart from that, environmental factors like metals, toxins, pollutants, infectious agents, all these can be a trigger for the development of Parkinson's disease. That's one thing. In Parkinson's disease, what happens is there is an accumulation of abnormal protein inside the brain. There is an accumulation of alpha synuclein and Lewy bodies. And these two basically disrupt the functioning of the cell and they cause cell death. As a result of which, you get the symptoms of Parkinson's disease. So basically, what happens is these cells undergo an early degeneration, early death, early atrophy, and the brain doesn't work properly. As a result of which, there is a reduced production of dopamine inside the brain, and it leads to the symptoms of Parkinson's disease. So again, there is this sort of a term whenever a patient comes to me in the clinic, they say, I have Parkinson's disease. But sometimes patients don't have all the same, not all patients have the classical Parkinson's disease. Some patients have Parkinsonism. So Parkinsonism is a group of disorders which looks like Parkinson's disease. It can be drug-induced Parkinson's. It can be because of metabolic problems, like low sodium. Then it can be because of psychiatric medications. Then it can be because of infection, in the brain. Any infection in the brain can mimic Parkinson's. So that's one thing. Then there are certain other disorders which look like Parkinson's disease, but they are not Parkinson's. They are far more aggressive. These are also called as atypical Parkinson's or Parkinson plus disorder. Some of these disorders include progressive supranuclear palsy, multi, like multi-system atrophy, corticobasal degeneration. So there is a group of disorders which look like uh, classical Parkinson's disease, but they have other features which are slightly different. And we need to identify these diseases because, you know, traditional Parkinson's disease or idiopathic Parkinson's disease can be well managed with medications, whereas atypical Parkinson's or Parkinson's plus are like far more aggressive in nature, and the response to medication is not really very good. And a lot of times patients keep jumping from doctor to doctor in the hope of cure or treatment. And in fact, it's very like disappointing for the patients and the caregivers, whenever they encounter such patients. And that's one thing we need to realize. Then there are certain like genetic disorders like spinocerebellar ataxia and Huntington's disease, which may mimic or look like Parkinson's disease. But again, these are far more aggressive diseases. They have other features. So you need to go to a doctor or neurologist who will be able to identify the symptoms and then actually decide whether the patient has features of classical Parkinson's disease or atypical Parkinsonism, which will then help you to prognosticate these patients. It will help you to actually diagnose these patients properly, and you can counsel these patients properly as to how to go about the treatment. So what are the stages of Parkinson's disease? So we have something called as a Hone and Yar staging. So it starts from stage 1. So stage 1 is mild Parkinsonism, like mild Parkinson's disease, and stage 5 is an extreme form of Parkinson's disease, so where the patient is immobile, bedridden, unable to walk, needs help for activities of daily living, etc. So, whenever a patient goes to a doctor, the doctor would actually stage or categorize the patient according to the severity of the disease. Based on that, we would be able to say how fast or how much the patient is actually progressing with respect to the illness. So how do you make a diagnosis of Parkinson's disease? So this is another problem we encounter, in our practice. Whenever the patient comes to us, they ask us whether they have Parkinson's disease. Number one, we need to realize that there is no, it's a clinical diagnosis. There is no scan or a test available which will help you to effectively diagnose Parkinson's disease 100%. Yes, we do have an F-DOPA scan, which is expensive and it's available. But in general, it's a clinical diagnosis. So when you see such patients, you examine these patients, you can be reasonably sure that these patients have Parkinson's disease or atypical Parkinsonism or Parkinson plus disorder. That's number one. Sometimes the doctor may ask for an MRI scan. He may want to rule out secondary problems. He may want to rule out a stroke. He would want to rule out a tumor in the brain. He would want to rule out other problems in the brain, as a result of which an MRI would be asked for. Also, very rarely the doctor would ask for certain blood tests like thyroid function tests, vitamin B12 like levels, etc., which will again help to rule out secondary causes. Sometimes infections like neurosyphilis, HIV, etc., need to be ruled out, in patients like tuberculosis, etc., need to be ruled out. Again, the other thing is, very rarely you may not be able to effectively make a clinical diagnosis, and then the patients may say that they are not ready to start medications. So in such a situation, there is a scan available. These are known as the DOPA scans, also called as a TrueDAT scan or an F-DOPA PET scan. And usually these scans are very sensitive. They help in like diagnosing like Parkinson's disease effectively. Whenever you're in like doubt, we usually ask for an F-DOPA PET scan, and it helps us to, make the diagnosis of Parkinson's disease. Usually we do it for patients in whom the diagnosis is actually in like doubt. Sometimes the patient may have tremor. We are not very sure whether it's essential tremor or Parkinson's disease. And then we ask for an F-DOPA PET scan, which helps to establish the diagnosis. So this again, I would like to say this to our, to all our people out here, that Parkinson's disease has good treatment options. Again, that's where I started with the overview when I said that whenever a patient hears a diagnosis of Parkinson's disease, they are very scared, and they are not, like most patients have a lot of misconceptions regarding the treatment options, especially with respect to the medicines. So there are good treatment options available for Parkinson's disease. We need to understand that. Usually, when the patient is evaluated by a neurologist, the neurologist would start these patients on certain medications. Most of these medications are dopaminergic medications. They can be either dopa agonists or plain levodopa carbidopa, what we call as like dopamine drugs. And these need to be, these are usually started on the basis of a prescription. And like these are prescription medications, the it's started by the neurologist, and you need to monitor when these patients are on these medications. Most of these medications are safe. We need to understand that they're usually started with very low doses, and the side effects are sometimes over exaggerated. It's actually exaggerated. It's actually very beneficial. In fact, if you see, there's this movie called as Awakenings. It's also based on a book by Oliver Sacks, where the story of dopamine has been properly described. These were patients who had Parkinson's disease, and when they were given levodopa carbidopa, the next day, in the movie, you would see that these patients started walking, they started, you know, they actually became better. So, what I would like to stress out here is that there are very good treatment options available for like Parkinson's disease, and patients need to be started on medications as early as possible. They need to be closely monitored by a neurologist or a physician for side effects. But again, I'm saying that the side effects, usually the side effects are mild, and the problems or the complications of the side effects are often over exaggerated. As the disease progresses, obviously patient needs more and more medications, and this is where the challenge happens. The patient then starts having side effects to the medications or problems with respect to the disease. So patients may present with on off phenomena. So they may be on when they are on the medications, they may be off when they don't have a medication. So if you see the patient without medication, the patient would be stiff and frozen, unable to walk. They would, the gait would be stuck. And when they are on medications, they would be having extra movements, they would be dancing, they would be having what we call as the dyskinesias. So, again, you would need to go to your neurologist, and the neurologist would adjust the medications for these patients. He would break down the medications to reduce the side effects. If medications are ineffective or they are not working well in advanced Parkinson's disease, or patient has complications to medications, then there are good surgical options available. One other surgical option available is deep brain stimulation surgery, also called as DBS, where two microelectrodes are implanted. It is like a pacemaker for like patients with Parkinson's disease. So you actually put like a chip or a microelectrode in the brain. It's connected to a pacemaker. It's a long surgery. It's a very good and effective surgery. And, a few weeks after the procedure is over, the battery is started, the patient is programmed. And more often than not, in about 70 to 80% of the patients, there is an improvement in the symptoms of like Parkinson's disease. Again, we have to realize that there is no cure available for patients with Parkinson's disease. So the focus is more on medical therapies. It is very similar to how you manage a patient with like diabetes or hypertension, where you have to take care of your sugars for the rest of your life, and you have to take your medications regularly. Apart from this, there are also two upcoming therapies. One is the device assisted therapy. So you have a small sort of a device which continuously gives the medication inside the body, and that produces the dopamine inside the brain. One of the device is apomorphine, and the other device is something called as produodopa. Again, these are subcutaneous infusions, very similar to a small Walkman we used to have, and it used to be like connected to the stomach through a small needle. It's basically on the skin, you put a small sort of a needle, very similar to how you give insulin, and you start the machine, and on a continuous basis, the medication is given. You don't have to keep on taking pills all throughout the day. And in general, it improves the symptoms of Parkinson's. Another upcoming therapy is MR guided focused ultrasound. So you don't have to make a hole in the skull and insert an electrode. You just have to go under a machine. It gives focused ultrasound, which is like laser guided inside the brain, and it actually causes a lesioning inside the brain. Again, it's an upcoming therapy. Very few centers in India are there which have this. Um, but still, the research is still ongoing for this kind of therapy. If you look at the established therapy, deep brain stimulation is an established therapy for Parkinson's disease. Like medical management is an established therapy for Parkinson's disease. Similarly, the device-assisted therapies or the infusional therapies are established therapies for Parkinson's disease. So this is another aspect which a lot of patients ask us about, the non-pharmacological aspect. So we need to realize that apart from the medications, there are also non-pharmacological methods which are complementary. So you have to continue your medical management, but these are complementary for the treatment of Parkinson's disease. So these include exercises, physiotherapy, Pilates, yoga, like Tai Chi, dancing, etc. And these also are effective in patients. So we need to realize that a lot of it is complementary to your medications, and you need to do it on a regular basis in order to establish an improvement in these patients. Apart from that, a lot of patients ask us about the role of uh, herbal preparations, Ayurvedic preparations, and homeopathic preparations, etc. So we need to realize that most of these herbal preparations, Ayurvedic preparations, and homeopathic preparations also do the same job. They also contain like dopamine, they also increase the levels of dopamine inside the brain. So, I mean, I'm not an expert to speak with respect to the alternative therapies, but in general, what I would like to say is, with respect to the Western like medicine, the medical management for Parkinson's disease is very well established, and most patients have a good quality of life when they are on these medications. So, a lot of patients also ask me about this. How do you prevent Parkinson's disease? Or their children ask me, how do we prevent Parkinson's disease? So, we need to realize that there is no cure for Parkinson's disease. Again, you cannot prevent Parkinson's disease, but you can delay the onset of the disease by having a healthy lifestyle. So, your sleep needs to be on time, your diet needs to be good. There is something called as a mind dash diet, that is the Mediterranean diet to prevent neurodegenerative disease. Again, that is helpful. Apart from that, exercise, aggressive exercise helps, running, jogging, swimming, cycling, this helps. Reducing the amount of stress, reducing, the amount of like medications that you take, especially, the antipsychotic medications, herbal preparations, etc. These are, like very useful. Also, if you take a diet which is very rich in probiotics, these have been proven to be useful. Coenzyme Q10, this is another thing which sometimes helps in the mitochondrial function. So these are some of the supplements which patients could take. So these are some other things which can help to delay or prevent like the progress of Parkinsonism. So this is the important aspect that we are speaking about. So we have a patient who's got Parkinson's disease, and how do you live with Parkinson's disease? So first, for the patients, we need to realize that as soon as as soon as a diagnosis of Parkinson's disease is made, we need to accept first is that the person may be having Parkinson's disease, or we need to accept the diagnosis. You know, a lot of times patients are in denial. They don't start treatment, they are in denial, they wait for many years, they come with falls, they break their bone, and they have other problems with respect to that. You know, so one of the important things we need to realize that is that we need to start treatment as early as possible, especially with medical management. So, as soon as you have a diagnosis of Parkinson's disease, see your doctor or see your neurologist who would start you on appropriate medications. Regularly follow up with your doctor. That's one. Then you need to make certain lifestyle changes. You need to avoid falls. You need to declutter the house. You need to make changes around the house where you don't means you shouldn't have any clutter, or you should like declutter the house. You should take the medications on time. Levodopa, carbidopa should be taken on an empty stomach. That's one thing. A lot of times patients don't take it on time, so it needs to be taken regularly and on time. Exercise is very important for patients who have Parkinson's disease. So both You need to do some form of cardio, aerobic exercise, and strength training. Both are important. Patients who have advanced Parkinson's disease would need to be put on a physiotherapy program. Again, I'm saying this is something which is very important because physiotherapy does help slow down the progression of Parkinson's disease. Similarly, you know, as I said that we have to prevent falls, you have to make some changes around your house. One of the things that you have to do is keep your bathroom dry, have supports around your toilet. That's one thing you need to do. You need to take the help wherever possible. You need to avoid falls as much as possible because the worst thing that can happen is you fall down, you break a bone, and then you fracture yourself. You could hurt your head, you could hurt your spine, and it could be fatal. So that's one thing we need to realize. The second thing is that a lot of times, most of these patients are senior citizens. They don't eat well. Their diet and nutrition actually goes for a toss. So you need to ensure that you're eating well. Often, when patients come to me in the clinic, I see that over a period of time, they're losing weight, they're losing muscle mass, they become very weak. So you need to ensure that the diet is, like proper. That's one thing. You also need to ensure that you take adequate proteins in your diet. You don't lose any muscle mass. That's also important. You need to keep yourself active. You need to move continuously. Drink plenty of fluids. Again, as I said, lot of these patients present with non-motor symptoms of Parkinson's disease. Some of them would have like depression, so you would need antidepressants. Some of them would have pains and aches, so you need to do stretching, exercise, massage, or you would need to take an oral painkiller sometimes to relieve the symptoms. So exercise and stretching does help, to reduce the severity of Parkinson's. Apart from that, you know, in advanced Parkinson's disease, speech and swallowing are sometimes affected in patients. So again, you need to change the consistency of the diet. You need to be evaluated by a speech and swallowing specialist. Sometimes you would need to take, basically a diet which is like thinner in consistency, soft smash diet. So these are some of the changes which a patient would have to take. A lot of patients who are elderly, they also have sleep problems. Now, sleep problems are a big problem. They are a big challenge. So sleep hygiene is important. So sometimes we need to take a mild sedative, or taking a dopaminergic medication at night would also help in some of the symptoms of Parkinson's disease, especially at night. Again, a lot of patients fall at night, especially when they are going to the bathroom. So they would need to have some aids which will help them, to pass their motion and stool at night so that they avoid any falls and accident at night. So that's one thing we need to realize. So in the initial part of Parkinson's disease, most patients are mobile, they are active, they are able to move around, they don't have much problem. So that's the first 5 years. The next 5 years is the phase where some problems are creeping in. They may have a little bit of walking difficulty, they may trip a little bit, they may fall down. So you need to be careful, or they may have complications with respect to the medication. And after 10 years of the disease, that is where the real challenges actually come in, where the medications, they are very brittle to the medications, they may have other challenges to the medications, they may have side effects, or they may have other problems like hallucinations, dementia, cognitive impairment, and behavioral problems. So understanding the symptoms of the disease also helps. So for the caregivers, one thing I would say, the worst thing that a patient with Parkinson's disease that you could actually do is neglect. These patients need to be monitored at all points of time. You need to prevent falls in these patients. You need to see that, they eat well. Nutrition is very important in these patients. Often most patients who have Parkinson's disease are elderly, and most patients who have their caregivers, they are also elderly. So sometimes overdoing things also is a problem. You try to micromanage every aspect of their life, and this causes a lot of interpersonal problems, interpersonal conflict, etc. So you have to adapt a lot. I often get this in my practice, where the spouse will come and say, "Sir, he's not moving at all." he's but we have to tell them he's not moving because of the disease. It's not he's not wanting to move. He's probably wanting to move, but he's not wanting because of the disease. So these are some of the problems that are actually there for patients with advanced Parkinson's disease. So for the caregivers, they need to adapt, they need to see what are the challenges that are there. Again, financial counseling, emotional counseling, these are some of the, I mean, like these are some of the things that we need to, actually take care of. So we are in the last part of the talk, sir, another like 5 minutes, if it's okay, like
Yeah,
Mr.
okay.
Prathaman.
Yeah, we are at
So,
5:40, so we
yeah.
will just extend it to a little bit today. No worries.
Yeah.
No worries, sir. Doctor, go ahead,
So,
please.
when we look at the outlook and outcomes, you know, the outlook and outcomes for Parkinson's disease overall is reasonable. It's good. Most of these patients have a good quality of life. We need to understand that. Again, we also need to understand that most of these patients have a very good lifespan. It's not that their lifespan is going to be significantly shortened. They may have some amount of morbidity or they may have some other associated problems, but they have a reasonably good lifespan. So it's not something where the disease is, is actually shortening your lifespan significantly. Yes, I agree with Parkinson's plus disease, there is a significant shortening of your lifespan, but with respect to traditional Parkinson's or classical Parkinson's, the outlook is usually good. So, in summary, I would like to say that Parkinson's is a recognizable medical condition. It is a treatable medical condition. Again, you need to go to your doctor who needs to identify and he needs to tailor the therapy. There are very good treatment options available for the treatment of Parkinson's disease, and the most of these patients, if they are treated well, would have a good quality of life. We need to understand that, and most patients are able to enjoy a good quality of life with proper like medical care and treatment. With this, I would like to thank you all for giving me an opportunity to speak on this illness. Again, it's not a very easy illness, so it's actually a very complicated sort of disease. I'm sorry for the technical problem that you
No,
all
it's
had
no,
in
doctor.
between.
Absolutely fine. It's
So the
absolutely fine.
flow
Thank you
was
very much.
slightly disrupted because of that.
Yeah,
But I
yeah.
hope I have, at least clarified some of the queries with respect to Parkinson's disease.
Thank you, doctor. Thank you very much for a very detailed presentation. I'm going to run through a few of the questions that are there, and I'll try and avoid repeating some of the things that you've already made in the presentation. So there's a question from Mukta Garg, who's saying, Dr. Parkinson's disease old age में ही mostly होती है क्या ऐसा ही है? Is it an old age disease only?
नहीं, ऐसा नहीं है. पार्किंसंस डिजीज यंगर एज ग्रुप में भी होती है, बट ट्रेडिशनली पार्किंसंस डिजीज 60 के ऊपर शुरू होता है. इट्स मेजॉरिटी ऑफ द पेशेंट्स आर एल्डरली. In patients who have genetic forms of Parkinson's or patients who have familial Parkinson's disease, the onset is prior to the, like prior to 60 years.
All right. Thank you. We have another question from Ranjana Kiran, who is asking, नींद टूटने के बाद डर सा लगने लगता है. She has fast feeling scared. उसका क्या कारण हो सकता है?
सो इसके तो कई कारण होते हैं. नींद टूटने के बाद लाइक डर लगने का कई कारण होते हैं. If she is speaking with respect to Parkinson's disease, then one thing is it could be because of a reduction in the dopamine in the brain. But otherwise, in general, सीनियर सिटीजन्स को एंजाइटी होती है, सीनियर सिटीजन्स को स्लीप डिस्टर्बेंस होती है, बहुत लोग को डिप्रेशन हो सकती है. तो उसके लिए आई वुड सजेस्ट दैट यू गो एंड सी योर डॉक्टर फर्स्ट, गेट योरसेल्फ इवैल्यूएटेड. अ लॉट ऑफ पेशेंट्स हैव हार्मोनल प्रॉब्लम्स, दे हैव एंडोक्राइन प्रॉब्लम्स लाइक थायराइड इश्यूज. So you need to first rule out medical causes and then you need to also get a psychological evaluation.
Right. Thank you, doctor. Doctor, there is a question, and I'm sure there are others also who have similar questions. This is from Mr. Bharat Mehta, who is 68. He says, at this age, I start forgetting names, forget to take keys, spectacles, purse, etc. Is this a common sign that he is talking about? And his specific questions is, which medicine or exercise senior citizens should take to ensure, control the day-to-day loss of memory?
So I think what he's speaking about is mild cognitive impairment, and This is commonly seen in the elderly population. If it's left untreated, they can progress to have a dementia. So one thing which helps these patients is that we could do good exercise. So exercise is very important. Proper diet. Again, there's something called as a mind dash diet, which helps to prevent neurodegenerative disorders like Alzheimer's disease, and sleep hygiene. You need to sleep well. Sometimes small things like using brain games. There are brain games like luminosity, which helps elevate. There's another brain game which helps, so you need to use that. But in general, physical therapy, keeping yourself physically active. That is the one single advice which I would give the elderly. Sleep on time, eat well, and
Right.
keep yourself physically active.
Right. Doctor, is it a good idea to exercise in the evening so that you feel a little tired in the evenings? Is it a good idea to, because normally people do exercises in the morning. Is it a good idea to have an exercise routine in the evenings to ensure this?
See, everybody's body cycle is slightly different. Some people after exercise are energized so much that they are unable to sleep. And some people after exercise are fatigued that they sleep off immediately. So you need to find a time which is comfortable for your body. You need to find a proper time where your body is warm enough, and you need to avoid injuries basically. So these are the three most important things.
Right. Doctor, you did make a mention of the drugs that, so the Shamila Ravi has a question about what are the drugs that induce Parkinson's, and, how can it be avoided? This is a question by Rashmi Verma.
So this is a very good question. So one of the drugs which is known to cause a lot of tremors and which is also known to cause a little bit of Parkinson's features is a very, very commonly used antacid drug. And this is a drug called as levosulpiride. This is available over the counter along with your omeprazole and rabeprazole, etc. So there's a drug called as levosulpiride. So you will see that as L or plus form. So you need to avoid these drugs. A lot of patients actually take herbal remedies, herbal preparations. So herbal preparations have heavy metals, which can sometimes trigger some other symptoms similar to Parkinsonism. So that's one thing we need to realize. Antipsychotics, antidepressants. So again, you need to take prescription medications. A lot of times patients take non-prescription medications or older medications, and they are abusing these medications for a long period of time. Another common drug which can sometimes induce some of the symptoms of Parkinsonism are the drugs which are used for vertigo. There are drugs like sinerazine which are taken for a long period of time, or prochlorperazine which is taken for a long period of time. I'm not naming the brands, but I'm saying that when you're taking it for a long period of time, it can actually trigger symptoms similar to Parkinson's disease.
Right. So would you advise that it's for instance, when patients go to doctors, they just take the medicines without really asking any questions. Do you think that patients should ask their doctor whether this will have any impact on some other form of illness? Is
The
that
90% of the times, the doctors are not at fault. The patients actually they abuse the medications, more than what it's intended for. So, for example, if you're taking an antacid and you're supposed to take it for 1 or 2 weeks, patients are taking it for 3 or 4 years. If you're taking a vertigo medication for 1 or 2 weeks, patients are taking it for 7, 8 years altogether. And it's more of, for them, it's more like a safety net. They
right?
feel that once they take the medication, they feel that the vertigo would go away or the acidity would go
So
away.
clearly, I think the key message is that yes, take your medicines, but the but be careful about
Long-term side
long-term
effects.
side effects, right? Um, Doctor, there are some other questions that have come in.
Sure,
Uh,
sure, sure.
at age at age stage 5 of PD, that is end stage of PD, will it convert to dementia?
So, Parkinson's and dementia are two separate problems. So, in advanced Parkinson's, we do get dementia. Yes, that is there. But Parkinson's and dementia are two separate problems. They don't usually coexist, in the initial stages of the disease. In advanced disease, yes, patients can have cognitive impairment. and they can have like dementia, but it will not be completely converted. So your predominant features would be that of Parkinson's disease. There could be additional features of cognitive impairment or a dementia, but that is not the major problem.
Right. Um, there are some doctors, Saroj is asking, some doctors are claiming cure with one injection. Is that a right thing? Is it happening? Is it something that is curable?
So there is no cure with a single injection. We are aware of what the injection that has been like spoken about. Again, I did speak about that drug
Right.
that is called as apomorphine, and it is a continuous infusion of that drug which is effective in treating Parkinson's disease.
Right.
So there is no single injection which cures the disease. So apomorphine is a form of infusional therapy which I spoke about, the device
Right.
assisted
Right.
therapy. And you need to use it on a consistent long term basis to have some improvement in the symptoms of Parkinson's disease. But again, it is not the first line of therapy. The first line of therapy is medical management. And the second line is actually like DBS. If the patient is not willing for DBS or not a candidate for like DBS, only then would you consider other therapies like the infusional therapies or the means
Right.
infusional therapies or the device assisted therapies or the MRG focus ultrasound.
There's a question from Aarti Ghosh. She says, can air pollution cause to Parkinson's risk?
So as I said, there is no one single factor which is attributed for
Right.
Parkinson's. So you need to have the perfect storm. There are multiple. So first of all, you need to have a tendency for Parkinson's, and then you need to have other factors at play. So all these factors together then contribute to the degeneration in the brain leading to Parkinson's disease. Why some people have a degeneration and why some people don't? Despite having similar exposures or similar environment, we still don't know the exact trigger.
Right. Doctor, there's one
If we
question that
know
is
that,
coming.
probably that will help cure the disease.
There's one question that is coming. It's giving a specific medicine, but I think this is from Saroj. She's saying she's been taking Nexpro 40 for over 20 years.
Hmm.
So is that a concern?
No, Nexpro 40 is not a concern, but 20 years of an antacid, I think he would need to ask the gastro doctor.
Right. Thank you very much, Doctor, for all your time. I'm sorry we've not been able to take all the questions, but we've, ensured that I've tried to ensure that most of the questions have been addressed in the presentation that is there. That Doctor gave a very detailed presentation that he spoke about, and touched upon all the factors that you may want to consider. I do agree that there's a fair role of caregivers in this entire in the treatment of people who have Parkinson's. So we will continue to do these sessions on a regular basis. We will have specialized sessions for caregivers as well. Thank you, Doctor, for your time, and thank you to your to the team at Apollo Hospitals for facilitating this. We will be back once again next Saturday at 5 p.m. with another session of Health Live at Seniors Today. Thank you once again, and see you next week. Thank you.
Thank you. Thank you. Thank you, everyone.
Thank you.
Subscribe now and press the bell icon. Never miss an update.